25 years of being a part of the Stark County community.
Search 1480 WHBC on Facebook.
Doctor, I'm screaming, doctor.
All right, good Wednesday morning, everyone. And, of course, that means it is time for our weekly doctor visit with Dr. Stan Anderson. I'm just glad we all remembered it was Wednesday, because you know how that Monday holiday thing can goof us all up. Good morning, Dr. Stan.
Hey, Pam. Great to talk to you.
I hope you had a good Memorial Day weekend.
Oh, it was wonderful. Family were in town, so anytime you get people coming in you haven't seen in a while and people that you care about, that just makes everything so much special. So, yeah, it was good. It was really good.
Good. Glad to hear it. Me too. All right. So we want to talk about diabetes, and we hear so much about it all the time, and we hear that it can be so problematic because it can affect so many other things, correct?
Yes. And so what I thought that what we would do for the next few weeks is we would talk about some basic medical conditions. And I thought what we would do is we would talk about some of the history and some of the findings and the reason that we want to treat them. So I thought we would start with diabetes. And the reason is diabetes is something that most people, when they end up getting it, they don't really realize that they have it. Diabetes comes in two types. There's type 1, which is the classic type, which is insulin-dependent diabetes, which means that something happened. They had a viral infection, that's the most common, and it destroyed, like a kamikaze, destroyed their pancreas, and it's not making insulin. But the most common, which is 90% of all diabetics in the United States, possibly as much as 95% of all of us, end up having type 2 diabetes. Now, type 2 diabetes is usually associated with lifestyle, with DNA, with genetics, where what happens is as we get older, we end up having more aggressive fat cells, and we end up making more sugar in the liver, and our pancreas just can't keep up. So the idea with type 2 diabetes is it's traditionally somebody who's been fine, they gain some weight, they end up starting to have just a little bit more symptoms, like they urinate a little bit more, and usually it's their fat cells are more aggressive, and the fat cells are telling the liver, make more sugar, and they're telling the pancreas that we're going to make a blocking factor so that the insulin that's made by the pancreas just doesn't work as well. And the reason that we want to talk about diabetes is so many people have it, and if you don't get it treated, it makes every other disease dramatically worse. So people with heart disease who have diabetes that are not controlled, they are the ones that are much, much more likely to have another heart problem. People with strokes, with diabetes, they're going to have another stroke sooner. And so part of it is it is one of those diseases that you usually don't have a lot of symptoms, but you want to get it controlled. And the critical thing is we have this test that we can run in the office, and oftentimes you run it through a lab, called the glycohemoglobin A1C. And it's a fascinating test. And I want to tell you the story of this test. When you think about hemoglobin is what carries oxygen, and it lives in the red blood cells. Well, as the red blood cells are traveling through the system, the hemoglobin ends up having interactions with sugars. The more sugars, the more interactions. The fewer sugars that there are, the fewer interactions. And the interactions then end up kind of like the tail of a kite ends up forming these chains of sugars that are off of the hemoglobin. So this is a test that is measuring how many chains and how long they are. And so it's a pretty good test because it gives us an idea Not what is your sugar right now, but what has your sugar been on average over the past 3 months? And it's an eloquent test because we can really answer the question whether or not you've had anything to eat or not on that particular day. It tells us how good has your control been over the past 3 months. And normally, the A1C should be below 5.5. So people without diabetes, it should be between 3.5 and 5.5. People with diabetes, it's 6.5 and higher. So people in that middle zone are called pre-diabetes or diet-controlled diabetes. They're not as much risk. The goal with diabetes is to get it below 7, because the higher the number is, and 7 tends to be the cutoff, the higher the number, your risk of having complications dramatically increases. So it's an eloquent test. It's elegant in the sense that it's simple. It's only a drop of blood, and we get an answer usually within 5 minutes at the offices, and we can tell you whether or not you have diabetes, how well controlled it is, and what we need to do right now.
And then, monitoring it. If you know you have diabetes, then you really need to be monitoring it to make sure that you're doing the right things.
Yeah, and there's all sorts of new monitors that are pretty amazing. So the first are the old drop of blood from the finger prick, and that's the way in which we've always tested it. Until about 7 to 10 years ago, we started to have these little devices. They're like a patch. You put it onto your arm, and the battery life, it works for about 14 days, and it can tell you your sugar number 1,000 times a day if you want to. You just put your smartphone up to it, and the device interacts with your phone, and it will tell you what your sugar is. It's dramatically less painful, and it gives you answers all the time. There's newer also iPhone devices where you can end up getting an idea of what your sugar is, and that's something that you wear. That's a lot more expensive, and obviously there's other internal tracking devices that can be done that are implanted. But the devices that we use now to monitor sugars are so much better than our parents' day and age. It is just so much slicker and so much easier now.
My gosh, my dad was a diabetic 50 years ago, and it ended up, he ended up having a stroke. I think he lived with diabetes, like you said, for a while without even knowing it. And it was so different back then,
Yeah, and the medicines that we used back then had so many side effects. One of the main side effects was that it caused your insulin to go way up. So as a result, if you fasted or in the middle of the night, if you didn't eat anything before going to bed, your sugar could plummet, and that is very dangerous. So if your sugar goes way up, you normally don't feel it. If your sugar goes way down, you will feel horrible, weak, dizzy, nauseated, and you could theoretically go into a hypoglycemic coma, which is life-threatening, and it can damage your brain. You don't want to go down that road. So the critical thing is we want you to lose weight safely if you have diabetes, and those older medicines, we tend not to use those as much.
And make sure you're monitoring and seeing your doctor, right?
It really is. It's important to make sure that you're checking those things. And also, you have to now, once you have diabetes, you have to control your blood pressure dramatically better. We talk about going on ACE inhibitors. You've got to control your cholesterol. You talk about going on a statin. Part of it is you just have to be a lot more careful because nothing heals as well.
All right. A lot of good information, Dr. Stan. I appreciate it. And we'll pick our next disease for next week.
I look forward to it.
Thank you, sir.
Canton's Morning News with Pam Cook.